Welcome everybody to the rotator cuff workshop. My name is Dr. Lee, and we're going to go ahead and get started. So the goal for today, this is a brief overview. We'll talk about who I am, a little bit about Knox Physical Therapy, what are past patients saying about us, different types of rotator cuff and shoulder pain. We'll go over anatomy and common diagnoses that I run into. The big question is, can physical therapy help me? And that's probably the question that you're asking yourself if you're watching this today. The single biggest mistake that you can make with your pain, the most common causes, how to treat your pain, next steps, and then special offer that we'll mention throughout to anybody that's here today. So at Knox Physical Therapy, our primary goal is to help people get back to normal naturally without the use of medications, injections, and surgery. Who am I? My name is Dr. Lee. People refer to me as Lee or Doctor, whatever you want to call me. Doesn't really matter. But I went to Campbell University. It's in a really tiny town in North Carolina called Bowie's Creek. How did I come to specialize in the rotator cuff treatment? Actually, it was through my PT school. I had a shoulder that was stuck, if you will. So when I would go to lift my arm, it would only come up to about right here. And that had come on pretty suddenly. I noticed it one day when we were going over shoulder anatomy, and it would hurt when I'd lift my arm. And then I started thinking about it a lot, and I thought, gosh, am I going to have surgery on this? And it just so happened that my manual therapist had seen this before, and he called everybody, all the students around. So excited about that. And he said, Lee, I want you to raise your arm all the way up. So I raised it up. It only came up a little bit, didn't go all the way up. And I did the other arm. It went all the way up. And he said, we're going to go ahead and fix this. This is an AC joint problem. And he whacked it a couple times and moved my arm around, and it was instantly better. And I was shocked because I've been dealing with this for months. I had a new baby, probably 2 or 3 months old, and so when I would go to lift the baby, it would hurt over on this side, and it just had become bothersome. And it was something, in the back, you think about in the back of your mind anytime you go to do anything. It's there, just nagging, and for him to be able to see it right away and to fix it was very impressive. And I started thinking, I wonder how many other people are out there like me that have the same issue that I could help. And that led me down a rabbit trail of finding all the different shoulder pathologies that I could find, and set me on a mission to be able to fix as much as I can without medication, without injection, without surgery. So that's how I came to specialize in it. This is one of our testimonials from a patient. Actually had a very similar problem that I did, had it on both sides of his shoulders. And this is a Google review, so I do have permission to share this. It says, I have suffered from shoulder injury for over 15 years. I went to see Dr. Lee for a knee injury. I said something about my shoulders to him. He asked to look at them, and after a few weeks of visits, I was able to lift both of my arms above my head. I never went to see anyone about my shoulders. I was afraid of surgery. After the treatments from Dr. Lee and his staff members with no surgery in my future, my knee and shoulders are doing great. Thanks, Dr. Lee and your staff. I've got one more. This is from Joey. I was suffering from shoulder pain that ran all the way down my right arm and into my pectoral. So it went into his chest and all the way down his arm. Within 2 months, I'm now basically pain-free, no surgery, no needles, and no pain medication. Dr. Easley and his staff were excellent, and the expense was minimal compared to other alternatives. Big thanks to the entire staff. I think of them daily because I feel back to normal. So you can see that there are a variety of different issues that can cause shoulder pains. We'll get more in depth right now. So what is the rotator cuff? It's a group of 4 muscles that move the shoulder. The shoulder is a ball and socket joint. So what's that mean? It's a ball, it fits in the socket, and it's actually the most mobile joint in the entire body. So you can move that shoulder all the way around 360 degrees. The only joint that can do that. The only one that comes close is in the hip. It's also a ball and socket, but it still does not have as much range as the shoulder. The four areas that I see that work together for shoulder movement are generally the neck, the collarbone, the shoulder blade, and the rib cage. A lot of people say, really, the rib cage affects my shoulder movement? And Mary Jo, I think you're a prime example of that. You have the pain back in your shoulder blade, but I feel like your problem is probably coming from your rib cage in the back. And we'll get more in depth on why that is. If you'll notice at the bottom of your screen, I put on there, call for a free screen. So for anybody that comes to my workshops, I offer a free screen. So in person, Mary Jo and BJ, I'll be glad to take a look at you. No questions asked. All I'm doing is trying to help anybody that I can. And if it's something that you can benefit from, then we'll talk about that. If not, then we'll at least have an answer whether PT can help you or not. So going a little bit more into shoulder anatomy, if you'll look, this is what we refer to as the clavicle, most commonly known as the collarbone. This is the scapula, this big triangular bone, and also known as the shoulder blade. And then this is the humerus over here, the really long bone of the arm. And then we have what's known as the joint capsule. If you can see here, it looks like if you can imagine this being a mop, this being the threads that come off the end of the mop, and then they attach over to this side. Now, this picture is not 100% accurate because these threads actually go more diagonal, and it causes a negative pressure, if you will. So they're actually twisted to hold it in there really tight. This makes it look like they just come straight over. That's important because whenever you have a rotator, a labral tear. So we're looking at, this is the joint capsule, also looking at the labrum. So when we have a labral tear, this negative pressure will back off a little bit, and it will cause lots of motion in the arm, which can lead to impingement. It can lead to joint instability, weakness, nerve issues, lots of different problems that we'll also talk a little bit more about. Biceps tendon. The biceps tendon, I believe, Mary Jo, you were also talking about pain up front. A lot of times when we have shoulder issues, our most commonly affected area is right here, where you said that you have your pain. That is also right where the biceps tendon attaches. So if you look over here, this is the bicep tendon, one of them. It comes up and it'll attach right here. The other one, bicep tendon, there's two of them, long head and short head. The other one comes right up the front of the arm bone, right in under that joint capsule. So a lot of us will get pain right here. So if you take your finger and just rub right over that painful area and you feel this little string popping, that's painful, that's your bicep tendon. So if you have a shoulder issue, I find that 90% or more will have a biceps tendon problem. And I believe that is because not only is the biceps an elbow flexor, but it's also a flexor of the shoulder. So if you have a problem with a rotator cuff that usually flexes the shoulder and it's not working, the biceps tendon is a secondary, and it will start working, and it will be overused and potentially lead to tendonitis. And I think that's why we get a lot of pain there. But in 99% of the people I see, they'll have pain right in that biceps tendon. Looking over on the right side of the screen, we're looking at a picture of a torn rotator cuff muscle. And this is one of the most commonly torn, the supraspinatus muscle. And BJ, this is the one that I was referring to with you. Whenever you go to lift your arm, and whenever you have pain right here, right as it's starting to drop, the painful arc, that is usually indicative of a tear in this area. because that's a muscle that is responsible for lifting the shoulder when you're going out to the side like this. I hope that makes sense. Other rotator cuff muscles right here, you're looking at, so if you're looking at the shoulder from someone from the front, this is what you're seeing. This is the inside of the shoulder blade. In other words, the back side of it is what is on your back. We can't see that right now. So looking at it from the front, biceps tendon, right up front, this, if you were to able to look at the other side of your shoulder blade from this view, you're seeing this rotator cuff muscle called the subscapularis. So you've got subscapularis, supraspinatus, and then when you turn around and look at the other side, you have two other rotator cuff muscles. So that's the shoulder anatomy. Let's move on to the neck and how it will contribute to shoulder pain. The neck has, let's see, several nerves called dorsal nerve roots or spinal nerves that come out the side of it on both sides. If you have disc degeneration, in other words, this disc is gone, or you have arthritis, this vertebrae and this vertebrae will fall on top of each other, and it will close this space, putting excess pressure on this nerve that's exiting the spine. Again, we're talking about circular space here. Why is that important? The neck, the nerves from the neck feed the arm. So if you're looking at what we call a dermatomal map, I don't know if you can see these tiny little numbers or numbers here where it says C3, 4, 5, and then C6 and C7. C3 nerve roots feed this part of the neck. C4 here, this is from the back side. C5, if you move over here to the other side, you start seeing how C5 and lower on the spine will refer down the arm. So this is the front side of the body. The C5 will actually go right down the front of the shoulder. This, again, Mary Jo, where you're saying the pain is up front, if you look down the front of your arm, and the pain's going down through there, I would definitely want to check C5 in your neck to make sure that it's not contributing to the pain there and isn't just biceps tendon pain. So you can see a couple different things can cause your pain where you're having it. Going over here, C6 goes down the outside of the shoulder and all the way down to the thumb. And then C7 will come down and then feed these first two and even the side of the other finger. So if you have numbness and tingling in your hands, sharp shooting or weakness in these fingers, a lot of times you'll have C7. C7 is that bump when you reach back and you're going down your neck and it transitions from the neck to the spine. Everybody has that little bump there, and that prominent bump is C7. If you push on it, you feel pain there. A lot of times that's where your problem's coming from. And then you can't see it really on this diagram, but this, looking at T1, or we also call that C8, comes down and feeds these fingers. A lot of people get symptoms in these last two fingers. Why is it important for me to point out the symptoms that are in your hands? A lot of times when you go to your regular doctor and you have numbness and tingling in your hands, they might automatically think, hey, you have carpal tunnel, when you really don't. You go and get an EMG study, nerve conduction shows that conduction is less in your hand, and that would be true coming from the carpal tunnel, or if the problem is further up. So a lot of times this diagnosis gets missed, and I always want to make sure we can check the neck to make sure that's not the actual problem. Brachial plexus and the collarbone and clavicle. So again, this is the collarbone and clavicle. Then we have the acromion, which is part of the shoulder blade. And right here where they meet up, this is called the acromioclavicular joint, or also the AC joint. This is where my problem was that I mentioned earlier. When you go to lift your arm up in the air and mine wouldn't go all the way, it gets stuck. This is most commonly diagnosed from a pain that is pinpoint right on top of the shoulder. And I can push on it and it hurts. It pops and clicks. It hurts when I reach across my body. It hurts when I reach behind my back. Those are the most common symptoms I see when you have an AC joint problem. Very easy on my side to fix most of the time, unless you have a bone spur. If there's a bone spur, then again, that a lot of times that happens right there at that joint because of the calcification that happens there, and then it builds up and then juts down, and that is a little more serious problem. Usually a bone spur, painful with reaching up, hurts right here, will cause this sensation down the arm, maybe even in the biceps and even around the outside of the arm. Depending on the location of the bone spur, it can be here, it can be back here, it can be in a lot of different places, but most commonly it's right up front. Let's look at what are secondary effects of having this AC joint stuck, if you will. Brachial plexus. Brachial plexus is a fancy word for a bundle of nerves that come from the neck and go down to the arm. These are the nerves we talked about a while ago, the C5, 6, 7, and T1. You can see C5, 6, 7, and C8, T1. All of these come out, and they all bundle together, and they go right under that clavicle and down the armpit, and then they distribute all the way down through the arm. A lot of people say, well, why does my arm hurt around here? Look at this nice little nerve that rotates around the side. A lot of times that's the culprit. So if this is stuck, if you will, the normal motion, whenever you lift your arm up, the normal motion is that those disassociate just a little bit, so the clavicle will stay down. It won't fully lift up with the arm, but it will rotate a little bit because there is a capsule here that will drag it along with it. But where the problem comes in, and I need to add a picture on here of that as well. I don't think it's on there. Nope. I need to add a picture on here as well. But if you look at the top of the clavicle, it looks like an S shape. And that S is right here. You can feel it on yourself. You can follow the clavicle around, and you can feel how there's a S shape in it. And when you lift your arm, if it's stuck, that clavicle will come back with it, and that the S shape in the clavicle will actually push down into this brachial plexus, causing numbness and tingling, and even cold and warm sensations, because there's an artery and a vein that follows these nerves as well. So it can compress all of those and cause all of those symptoms. That's why some people get relief with, when they're sleeping, like their arm will go completely asleep. They'll get relief from, finding a position at night. It's because they're taking the pressure off of that brachial plexus. What else? What else can we see from this picture? I think that's it. So the answer to this is to mobilize this joint, much like the guy did to me when I was in PT school. Now, that for me, the problem was here. The problem can also be here, where the clavicle meets up. The problem can also be with those symptoms down the arm. The problem can also be with first rib right here, or second rib, because if you can see these nerves, it's hard to see because it's not a 3D picture. These nerves actually go between clavicle and first rib. So if first rib is stuck, so with the lady I was talking to on here just a minute ago, where pain in the back of the shoulder, that if your pain is coming from first rib, that first rib can also stay upward. So whenever you breathe, or whenever you go to rotate, the point where the rib meets the spine back here, they don't move when they should. They should flex a little bit. If they're stuck and don't move, then it can also put pressure on that nerve, causing pain down the arm. So you can see how your rib cage can also play into this. This is just another picture of the brachial plexus and how it comes right across the top of first rib and across the top of second rib, and how if you have a problem with either one of those in the front or back, then it can cause a compression. Let's look at the shoulder blade. The shoulder blade has 180 degrees of total motion. So you get a combined motion of just the humerus, so just this joint of 120 degrees, and then 60 degrees of scapula or shoulder blade upward rotation. Now these don't happen one at a time. It's not like you go here and okay, that's the end of the shoulder motion, and then you go here and the shoulder blade moves. It's a combined motion. They're both moving at the same time as it rotates up. So if you lift your arm up and you're only able to make it here, I'm going to look at two different things. I'm going to make sure that this joint is moving appropriately. I'm also going to see if your scapula is adhered to your back, or if it's got its appropriate 60 degrees of motion. So if either one of them is limited, it will prevent the arm from coming up, which will actually cause impingement between this bone and the shoulder. If we go back just a little bit, so if we look here, if the shoulder comes up and it can't go past this point because it won't rotate, it'll actually crush the structures in here, biceps tendon, any nerves that follow through there, and you'll get this sensation around the arm a lot of times and pain right here in the front. So that could be an impingement symptom as well. So it's very important for the shoulder to move fully. And the people that I see with this issue are people that have had a fracture in the humerus at some point in their life. It can be a rotator cuff tear in the past. It could be a nerve damage that doesn't allow this to move appropriately. It could just be a shoulder strain where the patient didn't lift their arm for a couple months while it was healing and feeling better, and then when they go to move it again, they don't have the range of motion they used to have, and they end up with impingement. So like I said, there are multiple causes of impingement. You can have impingement from arthritis, from overall decreased mobility, like we just mentioned in the shoulder complex. Frozen AC joint, we've talked about that. A torn rotator cuff. If you have a torn rotator cuff, specifically the one that causes it to raise up this way, the supraspinatus or the infraspinatus, then the other rotator cuff muscles will try to do the work of that muscle. And it's like having, I don't know if you guys have, I know you've seen tug of war. Tug of war is when you've got a person on each side pulling. There's a four-way tug of war. It's pretty cool. I don't know if you've ever seen it, but you have a square in the middle, and then there are ropes off of each side. I played this at a youth game at church, and so you've got four different groups of people pulling in all different directions. It's pretty wild, but it's the same way with the rotator cuff muscle. You can imagine if one side overpowered the others, it would skew that square in a different direction. And the same if you had somebody that was weak over here, those people would get pulled in. So that's what I'm trying to show you on the rotator cuff. If you have one muscle that's not doing its job, it pulls the ball in one direction or the other, causing impingement on that side. Or a torn labrum. We talked about this a minute ago, and that's how it kind of backs off a little bit. Then you have a shoulder instability. That pain is usually in the back, really, really deep. Or in the front, really, really deep. That is usually, you get a lot of clunking in the shoulder with it. It hurts a lot when you go to reach back like this, like you're going to reach a seatbelt. Same with reaching under. Now, just because you have those symptoms doesn't mean that you have a torn labrum, but those are the most commonly where I see the pain. Let's go back to this arthritis because we haven't covered that yet. Arthritis is basically degeneration You've heard degenerative disc disease. You've heard it called lots of different things. But arthritis basically happens specifically in the ball and socket. You've got a layer of cartilage over the ball, and you have a layer of cartilage on the inside of where it articulates. And if one of those degenerates or both, then you have this grinding on the inside of the joint. And you can probably say, if you have arthritis, you can probably say, yeah, I definitely feel grinding. So what happens during that grinding process? Let's talk about a healthy shoulder. With cartilage on both sides, whenever you lift the shoulder like this, that ball inside of it, it will actually roll and it will slide in the exact same position. So it stays perfectly aligned. Whenever you have degeneration and it's bone on bone, instead of rolling and slide in the same position, it will actually roll up. And if you can see right here in this gap, it will actually roll up the joint and it will cause impingement right here of any structures. That's the biceps tendon, that's your supraspinatus, infraspinatus, any rotator cuff muscle that dives under that bone and attaches is all getting impinged there. So it's going to hurt in all directions. And you say, well, why does it feel worse in the morning and then it feels better in the evening? Well, that's because during the day, you've had some hydration of the joint by moving it and some increased flexibility of all the muscles around it. And you've given yourself a little bit of joint space. And that has allowed you to move the arm better. It applies to all your joints, your hip, your knee, wherever arthritis may be. It's stiff when you first move it, and it gets better throughout the day after 30 minutes or so. So arthritis can definitely lead to impingement. It can cause a number of shoulder issues. It can also cause tears, because if you're rolling up the surface and you're hitting it, you're pinching those structures. So let's say that you're bent over, you've already got limited range. You reach into the fridge to grab you a jug of milk, and pickle jar comes out with it. You pull it out, and then the pickle jar comes out, and you reach to grab that pickle jar really quick, and it's already impinged, and you slice those structures there. That's just one example of what may cause that. I've seen people with arthritis have a dog on a leash and it takes off running the other direction, and that can cause its own set of issues. But joint mobility is key. It's important to make sure you've got mobility. You can get it back with arthritis. In most impingement situations, you can get your range of motion back, and it's important to get it back so you don't get impingement. So what's the first step in this PT process? Since we've gone over all these diagnoses, what's the first step? You want to ask yourself, is my pain reproducible? In other words, can I move my arm and it makes it better or worse? Or is it just sitting still that it comes and goes? What type of, my question I like to ask is, what type of pain, specifically in the left shoulder, comes and goes? If you've got a family member next to you and they tell you, gosh, my shoulder really hurts, my arm is throbbing, my chest actually hurts a little bit, kind of have trouble breathing, what are you thinking instantly? You should probably be thinking heart attack or heart issues, and that is immediate 911 call or trip to the hospital. That's why I ask, is your pain reproducible? If I were to ask that person to raise their arm, does this recreate your pain? Normally they're going to say no. Does it make it better or worse? No. It's worse no matter what I do. Lifting it doesn't change anything. Ice doesn't change anything, because it's coming from the heart. It's not coming from the shoulder itself. So we've got to weed out those things that may not be related to your shoulder at all. So is it reproducible? And I've got a few questions here just to jog your memory. Reaching overhead, carrying objects, lifting, reaching behind your back, getting dressed, sleeping. Do any of those cause your pain to increase? If so, PT will usually help. Again, I've got a number there that you can jot down. You're not alone. There are hundreds and thousands of people in Knoxville alone that I've talked with that have shoulder issues. A lot of times we think that we are the only one with it. As you can see today, I probably hit on, if not your problem, someone that you've talked to, their problem. And it's probably very similar. There's a lot of people that have gone down the path that you're on. And the important thing to note is that it can be fixable, and it can be fixable usually without surgery, without medication, without injection. And I would encourage you to get that checked out more conservatively than to go to the extreme first. Whenever we do free screen, I'll go through and help you land on a diagnosis. I talked with a couple of people at the beginning of this workshop, and we were able to land on a couple of things. I want to diagnose your specific issue that you have, because if you come to this workshop and think, gosh, I'm going to get 3 exercises that's going to help me, you're going down the wrong road, because you can get online and you can find 3 different exercises to fix your shoulder pain, but there's one answer for each one of these diagnoses that I've given you. And if you do the wrong set of exercises, then you're going to end up re-injuring your shoulder, or it's going to get worse. And you probably already discovered that. So that's why I won't give exercises, just general exercises for the shoulder in these type of workshops, because I don't want to make someone worse and assume that they have one specific diagnosis. And that's also why I give a free screen, is so that it's more specific to the person and there's no obligation there. It's just so that you can land on your problem. And like I said, you can call us or you can send me a text if you don't want to call, and I can answer any questions that you may have. I think right now, tomorrow, I've got maybe an 11 o'clock, 2:30, and a 4. I believe that's what we have left for tomorrow for screens. All right. The single biggest mistake that shoulder pain sufferers make is that we ignore our pain, and you can probably relate. I've made some pretty big blunders in the past from ignoring them. I often tell the story of whenever I had a smell of gas in my house, and I ignored it for about 6 months, until my wife finally told me that they're going to go stay in a hotel room till we figure out the problem. I thought it was just a leaky stove when we turned it on, but it turns out that on further investigation, that there were 3 holes that were put through the gas line when the guy put our siding on our house. We light candles all the time, and very well could have blown ourselves up. But it took my wife saying, yeah, you need to figure this out, for me to actually address the problem. I'm glad she did. And I also find with guys, and I'm speaking of myself and a lot of the patients that I see, especially guys that I treat, it takes our wives saying, you need to deal with this shoulder problem, you need to deal with this back problem before we'll actually do anything about it. I don't know why we're stubborn, but hey, it's true. I'm glad she did it, because we would have blown up had I not addressed that issue. But in that process, I ignored it. And then, I don't know if there's really anything to alter except for open the door when you smell it, so your wife doesn't smell it and get upset about it. But I did actually poke a hole in the wall where I thought the leak was, and the gas smell just started pouring out. So I guess you could say that was altering it. In our normal pain life, the ways that we alter it are pain medications, ibuprofen, ice. We look up on internet and try to find an exercise that's going to work for it. We'll get an injection. Those are all different things that we do to try and alter our pain. And then ultimately, we end up handling it. And handling it for me was, for my shoulder, was a manual therapist who knew what he was doing, that put his hands on me and said, hey, I know what your problem is, and fixed it. For my gas situation, was calling the gas company and having them come out and check it, and then calling the landlord, or not the landlord, but the builder of the house, to come out and look at it and diagnose the problem. And then they actually tore the wall out and fixed the gas line. So Personally, if I would have tried to handle that situation, I would have probably blown myself up. Thankfully, I didn't. But and obviously, whenever I didn't know what was going on with my shoulder, I just let it go and freaked out about the possibility of having surgery one day until someone came along and actually told me I had an issue with it that could be fixed. Most common causes of shoulder pain that I see, if you say, Lee, what are the most common ones? Is a problem in the neck, like we talked about, coming from the nerve roots. It's impingement and poor posture. So yes, whenever your parents used to yell at you to stand up straight, they did sort of know what they were doing. And whenever I say that, I'm going to give you show you a quick example of how posture can affect your shoulder. So if you were to turn, I'm going to turn sideways so that you can see it. If I were to slouch my shoulders, which is this is what a lot of us look like. I may even look like this at some point during the day, at the end of the day, but you slouch your shoulders forward. What happens then when I begin to raise my arm is I get to a point right about here. I'm wincing now because that's not comfortable. And if I push it, springs a little bit, but it won't go past there. That's because this portion of the shoulder blade is blocking the arm from coming up, and anything in between here is getting impinged. That's an impingement thing we're talking about. But if I were to rotate my shoulders back and tuck them, much like one of our participants mentioned a minute ago, when they tuck their shoulders and lift their arm, it feels much better. If you tuck and then you lift the shoulder, I can go much higher because that shoulder blade is out of the way and there's no impingement happening. So postural correction is super important when we're addressing the shoulder. What does successful, non-invasive, natural treatment look like? It's hands-on physical therapy to move the shoulder and the surrounding joints. Stretching and strengthening exercises to retrain muscle memory. So hands-on PT is not giving you a set of exercises and sending you over into the corner. Hands-on PT is physically having a therapist there, moving your shoulder around regularly, especially in the diagnosis phase. If you come in and you see your therapist and he doesn't touch your shoulder, she doesn't touch your shoulder, there's a problem there. So find a hands-on physical therapist that is going to move your shoulder and touch your shoulder and figure out what is going on with it. If you don't, it's very difficult to diagnose the actual problem. And then the stretching and the strengthening exercises, those are very important. So you've got to, in a postural situation, you've got to stretch what's on the front to get it to allow you to come back, and you've got to strengthen what's on the back to get it to hold in place. You've got to strengthen rotator cuff muscles so that your arm isn't in that tug of war in in 3 different directions and not all 4, to retrain that muscle memory. And like we mentioned ago, next steps are to handle your pain. I mentioned the free screen, I beat it to death. I'll give you one last review here. And this is from Sarah. This is also on Google, you can find it there. It says, I found Knox Physical Therapy through an ad when I was having trouble or having horrible shoulder pain. I went to my family doctor and to an orthopedic doctor before attending the shoulder pain workshop. I have these also at my clinic. Both doctors were prescribing medications, scheduling me for x-rays, talking about MRIs and surgery and all kinds of things I just wasn't interested in. I remember when she called me, she was freaking out that she was going to have this done to her shoulder and she was desperate looking for something. I just wanted my pain to be reduced enough so that I could go about my normal life pain-free, or at least with tolerable pain. After my first appointment evaluation with Lee, he had found my problem, not what either of the doctors had said. There was immediate relief after my very first appointment. After hearing for weeks how terrifying PT is and how they will hurt me more than they will help me and all this crazy stuff, I am so happy I went to Knox PT. The team there was awesome. Lee, Lauren, Katie, Chris, thanks to all of them. I graduated PT today and I'm moving on pain-free. Definitely check them out. You won't regret it. So I wanted to leave you with that just to show you again that you're not alone in that situation. And the most important thing for you to do next is to get your pain handled.